Doc Talk with Dr. Paul Conley is a production of TTV, which is solely responsible for the content.
Hello, I'm Dr. Paul Conley, and thanks for tuning in to another episode of Doc Talk. I'm here tonight with Faith Tyler. Faith is a nurse practitioner right here at Plateau Medical Center, and Faith specializes in cardiovascular disease and cardiovascular health. She's actually here in the stress lab, which is where we are here tonight, and we're going to talk a little bit about stress testing and how Faith can actually work somebody up for their heart. We've talked in the past, Faith, about heart disease being the number one killer of Americans, also the number one killer of people in the world, worldwide. We talked a little bit about a prior episode where 1 in 3 deaths in this country is going to be heart related. And also, every 40 seconds, someone's going to suffer from a heart attack. Again, that's making heart disease the number one cause of death in this country. So what we'd like to talk about tonight, Faith, is basically, how do we work somebody up who may potentially have heart disease? So this is going to be a patient who sees their family doctor, who has multiple risk factors, they smoke, high blood pressure, maybe strong family history, and maybe they're having some symptoms of heart disease. So maybe in saying that, Faith, maybe you can just start out with, what are some of the symptoms that someone may have that they should be concerned about?
Sure. So a big symptom, of course, would be chest pain. We always want to work chest pain up and take that seriously. But new onset shortness of breath, or it may even be you think it's musculoskeletal pain, but that left shoulder, the left arm aching, or the jaw, those could be early cardiac signs. Even nausea, some new GI symptoms. Is it reflux? Is it cardiac? And we can help work that up to kind of make that determination.
I see a lot of people, Faith, in my line of work where I'm doing a lot of endoscopy and gastrointestinal disorders, you're right. I will see people that actually get referred to me because they're having heartburn or reflux. But when I start asking the patient about what presents your reflux, is it after you eat? And they say, actually, no, I really get it more after I split wood, or I get it more after I, did some physical exertion. And then I was like, well, this isn't probably heartburn. This is more what we would call angina, right?
Exactly.
So when we talk about someone that has some of these symptoms of shortness of breath, decreased exertion, we talked a little bit about with Dr. Burdett about, sometimes people may just notice that they used to be able to walk to the driveway and back to get their mail at the mailbox, and now they have to stop and rest. These are all signs of possible coronary artery disease. So when we talk about in your line of work as far as stress testing, and one thing about here in the stress lab, we're actually going to do a stress test here as well, and I'm actually going to be your patient. But when we talk about stress testing, I think some people may be somewhat concerned about the risk of a stress test, and maybe you can talk a little bit about what all we do here at Plateau Medical Center, what all you do here as far as the stress tests, like the types of stress tests, exercise, non-exercise, chemicals, things like that.
Yeah, so a stress test is considered a very safe test in general. It's not completely risk-free, but it's very low risk. About 1 in 10,000 could have a complication from a stress test, and that could be like an arrhythmia, something like that could develop. The benefit of having it here in the hospital is the ER is one door over if we would ever need, advanced life support or any type of care there. We have the ER one door over. So that's the advantage. And there are different types. So one would be just a treadmill only stress test. That's typically a younger patient that will just do a...
Like me, younger patient.
We'll just do a treadmill test for them.
I like that.
And then we also do the nuclear stress test here. And that gives us not only the EKG tracing, but it also has the addition of imaging to also look at the blood flow to the heart during exercise.
So one of the things, I think that one of the caveats about having the stress test done here at Plateau Medical Center in this stress lab is, to your point, this is performed right here on the ground floor, and just there, literally out the door is the emergency room. So if for some reason someone were to be on the treadmill, and we talk about arrhythmias, like you said, it's actually a good thing that we can declare these arrhythmias, because sometimes I think people when we think about arrhythmias, I think the most common thing people think about is atrial fibrillation. I mean, we hear AFib all the time. But, you know, people that have new onset AFib, that arrhythmia may actually be caused from, you know, heart disease or low blood flow, right?
Correct. Yes, some ischemia could cause those arrhythmias. And so that's excellent that we detect those during the stress test.
Because I think some people may have what's called paroxysmal AFib, and so they have these arrhythmias, and they may feel their pulse, or maybe they have an Apple Watch or something that picks up a pulse, but they don't really relate, you know, that this heart irregularity may be that the heart's irritated due to lack of blood flow, and that's something that you can pick up. So some of my patients, you know, will talk about stress tests, and one, they're concerned about the fear of having a heart attack, you know, on the treadmill. I think that's the biggest concern, not so much an arrhythmia or heart attack, but you just basically said it's 1 in 10,000, which, you know, your lifetime risk of dying in a motor vehicle accident is actually 1 in 110. So you have a far greater risk of dying in a car crash in a lifetime than having a major complication here on the treadmill.
Correct.
But what about the people that say, you know, I can't walk, I have a bad hip, I have bad knees, I have bad back. Tell me a little bit about how we can still stress the heart if they have some orthopedic issue that won't allow them to get on the quote-unquote treadmill for us younger patients, right?
So we we have the chemical version that we use here called Lexiscan or regadenoson, and that medication, it increases blood flow to the heart and opens up those blood vessels. So it simulates exercise, but using a medication to do that. The nice thing about this medication, you know, 15 years ago, the medication, it would last about 15 minutes. The side effects were miserable. With this new medication, you're looking at a minute and a half to 3 minutes of drug side effect. And we'll give you caffeine at the 3-minute mark to drink, either a Pepsi or a Diet Pepsi, to get rid of the medication. And if you would have any nausea or anything like that, I have some medication that we can also use in the IV to get the medicine out of your system. So it's about a minute and a half to 3 minutes is all the duration of the medication.
And so what is this medication? So when we talk about stress test, and maybe we can walk back a little bit. So a stress test, and the reason the word stress is basically we're stressing the heart, and we're trying to stress the heart to see if you can pick up these arrhythmias. Is that right?
Correct. Correct. So the medication or the exercise increases blood flow to the heart. We're increasing that workload. And with the medication, if there's a blockage, we can see that on the imaging that we do when we compare the resting image to the stress image.
So basically, on that type of exam, which you're injecting a tracer. So walk through that. So you take a picture of the patient's heart at rest, and then that gives you images of the heart, and then you stress, and you get. And so what would you see? What would be something that would indicate that person has a blockage?
We'll see a difference in those imaging. That area of the heart will not fill in like what we saw on the resting images. And our cardiologist, who is Dr. Garib, he will evaluate all of those, and he can let us know exactly where that blockage might be.
So basically, Faith Tyler here at Plateau Medical Center, she works hand in hand with Dr. Garib at Charleston Medical Center. And so basically, even though he's off-site, those images that are obtained here, he as a cardiologist will read those. And so what we're looking at is we're looking at, you know, the blood flowing through the arteries of the heart that supply the muscles of the heart. When you're resting, when you stress, the heart's going to require more blood flow, more oxygen, you're stressing it, and then if it's not getting the blood that it needs, it'll show up.
Correct.
So as far as like how long, and we're getting ready to demonstrate this again after the break, but how long does someone expect to be here for a stress test? And we talk about these protocols, Bruce protocols, so maybe you can walk me through that before we get on the treadmill.
Okay, so if you're coming in for a nuclear stress test, when you get to the hospital, we will get an IV started on you, and we will give you the first injection of the tracer, the radioisotope, and that will tag to the heart while it's at rest. It takes about 45 minutes to an hour to let that background radiation clear, and we'll take pictures, which takes 15 minutes on the camera. When you finish with the camera, you come in the room here with me. We'll get you hooked up to the blood pressure machine, the EKG. We'll do a baseline blood pressure and EKG, make sure everything looks good there, and then we'll get you started. If we do the treadmill starts out, we do the Bruce protocol, where every 3 minutes it will get a little bit faster and a little bit steeper until we get to a target heart rate. And we determine your target heart rate based on your age. So there's a formula. We do 220 minus your age, and then 85% of that is the target heart rate that we have to reach on the treadmill. Once we reach that number, we'll give a second dose of the tracer to tag your heart while it's at peak exercise. We'll have you walk for 1 more minute, and then after that the test is finished, and we'll send you back over to the camera to get those last set of pictures.
And then you go home.
And then you go home.
Okay,
Correct.
gotcha. I kind of like the test where you give like the diet sodas. I kind of like the Pepsi. And I'm a Coke guy though, but I mean, yeah, I kind of like I like that one. So what would I guess someone's watching this show? What would be the reason to do an imaging test over a non-imaging, or why would someone order a image testing, okay, where we're injecting the tracer over a non-image? Does that have to do with the patient's presentation? Does it do with risk factors? So what would have you basically say, well, I think this patient would benefit more from a stress test versus a imaging stress test?
So the imaging is ultimately the better test because we are getting an EKG plus the imaging, which is a little bit more diagnostic. Sometimes it's an insurance issue. If you're younger, the insurance company sometimes will start with just the treadmill test. Sometimes if you're younger and lower risk, that's just a good screening. We'll do the treadmill only version. So
if you have someone that's maybe young and maybe you feel like they're very low risk and maybe they've got some stress involved, maybe some anxiety, and you really feel like this young girl, let's say, is going through a lot at home, whatever, maybe the more expensive test, we can just get the information that we need by doing that. Because when we're doing the stress test, which, like I said, we're going to do that here after the break, you're watching the tracing in real time, and you're going to be looking for what?
We're looking for, we call ST changes, which indicate that there's an area of the heart that's not getting good oxygen, and we're looking for those arrhythmias. So sometimes the treadmill only test is really good for those that are having palpitations, especially with exercise. It'll unveil those arrhythmias that we're looking for.
So if a patient has those during the exam, is that when you stop the exam? If they have these before they reach their target heart rate, how do you proceed with that patient?
Yes, if they're beginning to have what we would call a dangerous arrhythmia, or we're seeing a lot of ectopy, they're looks like they're not getting as good of oxygen as we think the heart needs, then yes, we'll stop the treadmill test and we'll consider that a positive test.
And if they have a positive test, then that's when you would proceed with?
They would follow up with the cardiologist to see if they need like a coronary CTA, or if they need a cardiac cath, if they need like a stress echo. So there's some additional testing that this could lead us to.
So so then that would then look at possibly catheterization and then stenting and those type of things. Okay. Well, Faith, I'm really tickled to death that we've talked about this, but we're getting ready to come on a commercial break. And what we're going to do at the commercial break is Faith is going to hook me up to the electrodes, going to put me on the monitors, and then I'm actually going to get on this treadmill back here, and we're going to demonstrate what an exercise stress test is here at Plateau Medical Center. So we're going to take a commercial break. You're not going to want to miss this, so we'll be right back.
WZTS 16 Hinton Cozy TV is your local television station, serving southern and central West Virginia with classic shows and original local programming. Whether you're watching comfy classics you know and love, or content created right here by local voices, WZTS delivers programming you can rely on every day. Learn more about our station, programming, and coverage areas at WZTS.tv. You're watching Doc Talk with Dr. Paul Conley on WZTS 16 Cozy TV. Stay with us. We'll be right back after these messages.
Vandalia Health is proud to be a West Virginia-owned healthcare system, bringing together the hospitals and providers of CAMC, Mon, and Davis. We are dedicated to enhancing the health of our communities through clinical excellence. Our compassion and commitment remain the same, with people you know and trust to care for you and your families. With more specialists, hospitals, and outpatient locations, we are delivering expertise and state-of-the-art care. Vandalia Health, expert care close to home.
Welcome back. Doc Talk with Dr. Paul Conley continues on WZTS 16 Cozy TV.
Hello, I'm Dr. Paul Conley, and thanks for tuning back into Doc Talk. As I stated earlier, we're going to perform a stress test right here at Plateau Medical Center. My guest tonight is Faith Tyler. Faith has talked to us before the break about the importance of stress testing. We've talked a little bit about how heart disease is the #1 cause of death in the United States. 1 in 3 deaths in the United States are directly related to heart disease. Every 40 seconds in this country, someone's going to have a heart attack. So in saying that, Faith, we talked a little bit about the different types of stress tests. And so at the break, you shaved my chest.
Correct.
You got me hooked up to how many things are stuck to me?
We're doing a 12-lead EKG.
So I got 12 things stuck to me. We've done a blood pressure cuff. We got the blood pressure, and then basically we're going to kind of walk through this stress test. And so maybe you can talk about what am I standing on, maybe some of the buttons and some of the things that we got around here.
Sure. So we do have an emergency stop button. So if you feel that this is getting to be too much, you're getting short of breath, we do have an emergency stop button here. I also can control it from my side as well. There's a chart here on the wall that kind of lets us know how short of breath or how labored you're beginning to feel. So you just kind of let me know where we're at on that chart as we go if you start to have some leg fatigue or shortness of breath. We've already got your blood pressure checked, and it's already loaded in the computer, and we are ready to go.
And the target heart rate, this is this thing over here we talked again about. So there's a certain number that I have to achieve in order to have a valid stress test, right?
Correct. So we do the formula 220 minus your age, and so we ended up at the maximum heart rate that you would want to reach is 167, but we only go to 85% of that number. So 141 is our target heart rate for you.
So once you get to 141, that's considered a target heart rate. And then at that point, then what am I going to have to do?
So at that point, we would give you the injection of the tracer if we were doing a nuclear test to tag to your heart. Now, if you are not feeling fatigued, we will keep going, and we will keep pushing a little bit until you begin.
I'm going to feel fatigued. I can guarantee you. I'm going to feel fatigued.
So if you're not feeling fatigued, we'll keep going. If you are, we will do 1 minute more of walking at a lower speed to finish out the test.
Okay. So maybe since I'm hooked up to the 12 lead, you can maybe talk to us about to your right there.
Sure.
That is basically an EKG, and tell me what you're able to see from this electrocardiogram.
So this EKG lets me look at different portions of your heart. So over here we're looking at the inferior or the bottom part of the heart. In this area we're looking at the lateral side or the left side of the heart. In here we're looking at the septum, which is the middle part of the heart, and this is the right side on lead V1 here. So this kind of, we call it this QRS symbol. That's when the ventricle is beating, and what we're watching for in this stress test is this portion right here of the test. If it starts to go up or down, that shows us that there could be an area that's not getting good blood flow during the test.
And then what would you do there?
It depends on the severity. If we have elevation in that, that's a more serious sign, so we would stop the test at that point.
That's that quote-unquote ST
elevation.
segment elevation.
Yes. So with depression, we keep an eye on it. If you're having chest pain, then we would probably consider stopping the test.
So what about some of these arrhythmias that you had talked about? We talked a little bit before the break about arrhythmias, and we think about arrhythmias, that's where the heart So basically this right here is what we would call normal sinus rhythm,
Correct.
right?
Correct.
And then arrhythmias, maybe you can define or describe some of the arrhythmias that you would potentially see during a stress test.
So the big one that we hear around here is atrial fibrillation. And so that would be when we start seeing the atrial beats disorganized. You can't really see a clear beat in the atrium. The heart rate becomes irregular. So AFib is one that we can see pretty frequently. Another one is we'll just start seeing some PVCs, which people think is extra beats. And that's just when the ventricle is getting a little bit irritated from possibly a lack of oxygen, and we start seeing some extra beats, which is the ventricle contracting before it should.
Okay, so my heart rate right now is 67,
67.
Right? All right, that's because you make me nervous. So I guess let's go ahead and
okay, if you want to straddle that belt.
So get on each side here, like this.
And I'm going to start the belt, and then you step on when you feel comfortable.
What if I don't feel comfortable? But I got to do it anyway. Okay, you ready?
We are ready.
I've never had a stress test done before, so this is new for me. You ready?
You ready?
All right.
All right.
How am I doing?
Just keep a relaxed grip there.
Relaxed grip.
Yes.
Okay.
And then we're going to get started here. The treadmill is going to
It's
go
getting faster already.
It's going to go up
What?
in elevation and a little bit faster. So we're going about 1.7 miles an hour. And
It
every
feels like 30.
3 minutes, this will get a little faster and a little bit steeper.
3 minutes of this.
Yes. And all throughout this portion, I'll be watching your EKG and checking with you to kind of see where we're at on
And
this.
I look at the perceived exertion.
Yes. Yes. So you can see your heart rate has already picked up a little bit.
Whoa, that's because I'm out of shape.
We're now at 100.
Well, there you go. Winter's not been too kind to me.
How you feel?
I feel 6, 7, 8.
Okay.
Very, very light. So now on this tracing, you're still looking for any kind of changes or anything going on there?
Correct. We're watching this ST segment to make sure it stays at baseline and it doesn't go up or down. Right now you are looking great.
Thumbs up, looking great. And again, here at Plateau, the stress lab is just next door, as you said, to the emergency room. So, but again, 1 in 10,000 chance of me having something bad, right?
Correct. Very, very low risk test. Very low risk.
She keeps telling me that as I continue to walk up this hill.
And we are at 107.
All right.
Good, stop.
Let's keep going. I think I can keep going. So, how
You're
many of
at-
these stress tests, maybe you can tell us a little bit, how many can you do in a day here at Plateau?
We try to keep the number between around 5 a day, just so that we can move people through quickly. They're not waiting on camera time, because it takes 3 to 4 hours in total to get the test.
So let me ask you a question. So after you've done the tracer and it's been sent off for review, what's the turnaround time for someone to get their stress test results read?
So that evening, I send everything to Dr. Garib for him to do a review and make sure everything looks good immediately. And then within 24 to 48 hours, he usually has a dictated report on the chart and ready for their ordering provider.
So that when that result comes back, it not only comes back to you, but it actually goes to the physician that orders the test?
Correct. And it's also available on the patient portal, so the patient also has direct access to those test results as well.
So would the physician that's requesting the test, would they receive some additional information if the cardiologist felt like they needed additional testing? Would they get that as well? We're going faster.
So the Dr. Garib will write in the report that it was an abnormal stress test, and that will indicate to them that we need additional testing, either a cardiac catheterization or a coronary CTA, stress echo.
So then the referring doctor would then obviously get that report, and then they would know that they would need to refer for possibly even a cardiology eval.
Correct. And we are up to 120. And you are at stage 2, going 2.5 miles an hour at a 12% climb.
It seems like I'm going 50 miles an hour at a much steeper incline. As the camera crew's laughing at me because they're not on the treadmill. Seems like I'm the one doing all the work around here, Faith.
And you are looking good over here.
So again, you're looking at those ST changes.
Correct.
You're looking for any arrhythmias or anything like that?
Correct. And so you've not had any arrhythmias, and your ST segment looks good.
Do you ever have anybody that doesn't achieve their maximum heart rate? And
Yes.
if so, what do you do?
Yes. So if they're here for a nuclear stress test, what we would do is stop the treadmill and just allow them to sit on the stretcher, and we would inject the regadenoson or the Lexiscan and switch it to a chemical stress test immediately. You don't have to come back a different day. We would do that immediately. If it's a treadmill only and no nuclear testing is involved, with those patients we would stop the test and let their doctor know that we possibly need to do a chemical version, and they would have to come back for a chemical stress test.
Now, I've always heard that if someone has a baseline abnormal EKG, tell me about that.
So there are certain things that would prevent you from being able to walk on the treadmill, and one of those is called a left bundle branch block. So that would be an EKG abnormality that would make it difficult for me to monitor the EKG safely. So those patients would not get a treadmill stress test. And some AFib we do not put on the treadmill because we don't want them to jump into an uncontrolled fast rhythm.
So if you had, so you would get that baseline before you'd put them on the treadmill.
Correct. And we are at 133. And you got about 30 seconds, and you're going to get steeper and faster.
That's what I like to hear. Steeper, faster, harder. I get it. Well, how's it looking?
We're looking good. No arrhythmias. ST segment looks good.
So am I going to live another day?
You should. So if you have a negative stress test,
Yeah, tell me what that means, because I think people want to understand, like, what is the validity of this test?
and you got 5 more seconds before you go steeper, faster. So if you have a negative stress test, you typically have less than 1% chance of having a heart attack within the next year. So that's great.
So 1%.
Less than 1%.
Less than 1%.
137. And you are almost to target.
Almost to liftoff.
Any chest pain?
I am 910.
Okay.
You think I want to say anything other than that? No. Oh, come on. I was almost 141.
You were almost there.
Now I'm 139.
And you are at target.
All right.
So we are going to slow you down.
We are slowing down.
And just keep walking there as the treadmill
fall
comes
off.
back down. Don't jump off.
Don't jump off the ride. Keep your hands.
And then I would monitor you for at least 5 minutes after we finish the test. Some people have delayed changes on their EKG, so we keep you on the EKG and keep monitoring the blood pressure for at least 5 minutes after you finish the test.
Okay.
All right, and that belt is coming to a stop.
How's it look?
All right, we are looking good over here. Like I said, we're going to continue to monitor you for just a few minutes to make sure we're looking good.
Not bad. Actually, this was not as measurable as I thought, so.
And that heart rate is coming down nicely. You're already in recovering well.
So we're getting ready to come to the end of the show. So what you've seen here today, we've seen a stress test, as I can't talk, here at Plateau Medical Center with Faith Tyler. So for those watching the show, and if you're interested in a stress test, what's the number to call?
304-469-8600 and ask for our central scheduling. You would have to have an order from your provider and get that set up for you here at Plateau. We typically can get you in pretty quickly. Usually within 2 weeks, we can get that stress test scheduled and taken care of for you.
469-8600 Central Scheduling. Send the order in. Faith Tyler here. We'll get you on the treadmill, check your heart out. So American Heart Awareness Month is the month of February. I'm Dr. Paul Conley, and you've been watching Doc Talk and watching me do a stress test. Until next time, have a good night.